Hi there. Welcome to today's episode of Stand Up. I will be hosting a hangout tonight, a little after 8, probably closer to 8:30 or 9. Look for the email and I will let you know what time tonight. But tonight's the night I have been both dreading and looking forward to because my 21-year-old Ava is flying to Europe. Long story, but she'll be there for about a year. Not sure when I will see her again. Maybe not until the holidays, but I am so excited for her journey and everything that is to come. But tonight I'll be saying goodbye to her, sending her off. And so I am looking forward to seeing you as a distraction. So join me tonight around 8:30 or 9. And I will tell you all about tripping on mushrooms with my daughter. I said I was going to do it. Then the next day I said it was canceled. And then it was back on. We did it. That's right. Tuesday together. And I look forward to telling you all about it, but it was wonderful. It was fun. It was nothing negative. It was really great. And I highly recommend it to many of you. Many of you had already highly recommended it to me. To do it with my daughter was really special, and I can't wait to talk more about it, more in detail, probably in future episodes, and certainly in conversations with you at the Hangout and other places. Thank you for your encouragement. Thank you for your support, and thank you for being here today because I've got a great guest joining me. It's Dr. Erin Stevens. She's a obstetrician gynecologist at a hospital in Minneapolis, and she is part of the Committee to Protect Healthcare, which is an amazing nonprofit organization. And today we get an update on the state of women's reproductive health and rights, which is something I try to do with different expert guests about every month or 6 weeks or so. Such an important issue because those rights are under assault and being taken away, of course. And Dr. Erin Stevens is a hero who explains it all. And I really enjoyed our conversation. I think you will too. Normally, I do a full rundown of the day's headlines and a clip show, but that takes me hours to prepare. And I have been spending much of the time with my daughter and her boyfriend, as well as my other daughter and family stuff. So I am partially off this week, but I do have this great conversation and I should have something for you tomorrow as well. And I hope to see you tonight to talk about all those headlines. But forgive me for not doing the regular format of the show. We'll get back after it next week when I have a lot more time. Okay. Please go follow Dr. Erin Stevens on Instagram, support the Committee to Protect Healthcare, and do whatever you can to join the fight to protect women and their rights in this case. So let's do it right now with Dr. Erin Stevens for the first time ever on Stand Up. You can watch this on Substack and YouTube at Stand Up with Pete. I've been reading all about you and your background and your work, and obviously you're an advocate and an activist for healthcare, specifically for women and women's reproductive rights, obviously because you're an OB-GYN, as they say. A doctor friend of mine said OB-GYN, but an obstetrician gynecologist, is that the technical term?
Yes. Some people in the South say OB-GYN. And I hate
those people. What is the difference between an obstetrician and a gynecologist? Why are we combining them in one doctor's title?
Sure. Obstetrician is the pregnancy and pregnancy-associated care. Gynecology is everything else that has to do with the reproductive system on that end.
Is everybody an OB-GYN or some people one or the other?
Some people do one or the other. Some people stream off into one direction or another or specialize into different areas. So every system's a little bit different. And in like rural areas, people have to do a lot more. And in cities where you can see any sort of hyper specialist, it's a little different.
Quickly, in a live chat, someone wants to know what your shirt says.
Oh, everyone loves someone who has had an abortion.
Oh, that's good.
Yeah.
I don't usually like
this pin too, but it reflects the light too much. But
abortion is normal. Oh, yeah, those are good. Are you selling that?
No, I don't remember. I've got this at some sort of reproductive healthcare conference. I get lots of, like, I have a uterus sitting here. I have a vulva sitting here.
I wish you would have just said, I have a uterus and not sitting here. I have a uterus. Some women don't, but they get rid of it. Not to go off on too much of a tangent, but are hysterectomies becoming more common as preventative care, or are they less common because there's other procedures now? I had this argument with a woman recently for 5 seconds because I don't know, but I had heard that more women are getting them for preventative to prevent potential issues, cancer, et cetera. But then I heard like, oh no, they're less common. What's the answer?
Yeah, I think overall hysterectomy, actually removing the full uterus, is less common because we have IUDs and better birth control options that can control bleeding and other issues. But removing the tubes, just the fallopian tubes for either contraception or cancer risk reduction is more common than it had been in the past.
Cancer risk reduction would be a reason for a full hysterectomy?
Not necessarily, but just the tubes, fallopian tubes.
So it's like a partial. People that don't know what they're talking about, like me, confuse it all. So thank you.
It depends on genetic risks and things like that too. So
as a result of what you just said about, birth control for this generation, I have daughters who are 21 and 18, and I was about to betray their choices, but I won't. But they use birth control, obviously. And my point is that generation, overwhelmingly, there's way better things. We're going to get to talk to mifepristone and so on. But as a result of this generation of women likely using more, and I know teenage birth rates are way down in America and so on, is that why they won't have issues when they get older? Will this generation have fewer issues, including, not to mention, the HPV shot vaccine?
Yeah. I mean, the problem is we have so much backlash to science and medicine too, right? So like
the same time.
HPV vaccine, cancer prevention, and people are making into this, well, why are you trying to give my child a vaccine related to sex? Because it's preventative. You need it beforehand. And there's so much on social media right now that is like anti-birth control. So that's really hard to try to combat that misinformation. It's very Maha-esque. I think in some ways we'll be better, but are we going to sort of swing the other
regress?
direction?
That's a really good point. Like if all things had continued to progress the way they were just a few years ago, the answer, I guess, would have been yeah. But now that you're taking into consideration the fact that we're moving back to the medieval ages,
exactly,
that could cause the numbers. Okay, so let's just talk a little bit more about you and your background and your career, because it's really interesting, especially the community you're serving right now. But let's just ask the question, why medicine and why this specialty?
Yeah, why medicine is a great question, because nobody in my family has been a doctor before me. And it was just like this epiphany in high school that, hey, I'm going to go into healthcare. I like caring for people. And probably initially OBGYN was the last thing I wanted to do. And then I slowly realized, oh my gosh, this is everything I care about. I'm very pro-abortion rights. I'm pro-contraception, sex ed. Both of my grandmothers had gynecologic cancers, so it just made a lot of sense. And ever since then, it's been the perfect match. And for better or for worse, if you're in reproductive health care, that is the most politicized portion of medicine. So you just naturally make it into the advocacy avenue. And that's been a piece that I really like a lot. I like being able to talk to legislators and try to move the needle on different policy, educate the general public on the misinformation that they're hearing and what's the reality for patients. Definitely a passion of mine.
And you do a great job at that in appearances like this one. But most importantly, I would say, like, your Instagram, is that your primary place you post? You do great videos that I watched just a few in prep. I was like, A, you're super likable and really funny and interesting. But more importantly, like, they're very informative. Like, they're really well done and a public service. So please go follow Dr. Erin Stevens on Instagram. What is it again? I just lost it. Your Instagram.
Erin Stevens, MD, OBGYN.
Go follow her.
Erin Stevens is.
Yeah, I bet. Go follow. That's got to be annoying. Or the greatest thing in this day and age, because if you Google Erin Stevens, you don't want to be found. You're going to have a few other Erin Stevens. So you go to med school, you work in private practice. Now you're working in a hospital. You've kind of done a lot of different, specialties programs or populations, demographics that you've worked with. Yeah. And so I think my question is, you learned everything academically about and scientifically, medically about this, but there's some things you can't learn in med school that you have to learn in your career and practice. And I wonder how much you've learned about, you already knew to a certain extent, I'm sure, but how much you've learned about how much women are disadvantaged and struggling as a result of our political paradigm here in the U.S. How is that question? Is that a good, given what you've seen and learned?
I think in medical school, they try to prepare you for some of the social determinants of health and what reality looks like, but you really don't know it until you care for a patient and you have to look at them as a whole human being. And hey, this person doesn't even have access to transportation. So they are here in the hospital for an emergency visit, but are they going to get any prenatal care after this? To be able to be here, they brought their 2 young children with. No one else can watch those children at home. What if they need to be admitted to the hospital? What's their child care situation? Mental health wise, a lot of people are struggling, and there's just such limited access to psych care in the community. And so just thinking about all those components, I can treat the acute issue, whatever's going on, but now I'm sending them back out into a world that is not really friendly to them. And what happens? Because
emergency care is not health care. You take the ball.
Yeah. Emergency health care is healthcare, but we want to be doing more preventative care and having people see kind of a primary care provider, the person that they can trust and that can keep track of their issues, rather than I'm going to show up to various emergency rooms when there's something that's really, really terrible that is potentially life-threatening. instead of getting to that point, let's manage things in a really safe, kind of normal, calm kind of way, rather than now it is an emergency and we all have to freak out about it, right?
Emergency care is healthcare, but it wouldn't be required in every instance if you had preventative care, if you had access to a doctor, if you could get an appointment, if you could afford it, if you had the three-legged stool that is healthcare, which is quality, cost, and accessibility, then you wouldn't end up necessarily in the emergency room in the last place.
Exactly. It would be much better for patients' care. We'd have better outcomes. Financially, it's better as well if we have preventative care covered and you're not showing up to the emergency room and having huge bills for those kind of urgent issues. It's better for everyone, reduces the wait times in emergency rooms as well. So those who are having emergencies can be addressed appropriately. So we have kind of a messed up system where some people can only access emergency care, and they're either showing up when things are a huge, huge problem or really misusing the emergency room as more of their primary care facility.
So tell us about who you're working with right now at the hospital. You're in Minneapolis?
Yeah, I'm in Minneapolis. I serve a primarily underserved population. Patients, a lot are immigrants. A lot do not speak English. Many have limited financial resources and are on Medicaid and have issues with their transportation to appointments, transportation to the hospital. And that is a population that really needs healthcare, needs good doctors taking care of them, and unfortunately doesn't always have that advantage. We have safety net hospitals closing all over. Here in Minnesota, our major downtown Minneapolis safety net hospital was at risk of closing this year if our legislature hadn't put some funds towards their direction. Across the country, there are almost 800 hospitals at risk of closure because they don't have the finances to continue to serve the patient population that unfortunately can't reimburse at the appropriate rate. So we are in trouble.
Have you seen that get worse in the last whatever period of time? I don't mean to be political, but we can talk about Obamacare, which is the only major reform to healthcare in our lifetimes, but that came up short in so many ways. So while it improved many measures, expanded Medicaid, and it improved some affordability for certainly people in certain categories, including freelancers, but it didn't necessarily improve health outcomes. I actually don't know. But the point is, so much has changed, and so much has been, including the Supreme Court, changed about that policy once it passed. Some states certainly never even passed the Medicaid expansion. I can't remember which ones are still holding out, but Texas is certainly one of them. And so have you seen things get worse in your time, in your career, better? Is there a way to measure anecdotally?
Yeah, absolutely. I mean, the Affordable Care Act in and of itself did so many great things for covering preventative care, birth control being covered, making sure that pregnancy isn't seen as a pre-existing condition, so you cannot get coverage in some cases. So we have a lot of improvements, but it's not perfect. It went from super, super not perfect to a little better, right? So we take the gains that we can. But with the current administration and cuts to Medicaid through the big ugly bill, fewer people are going to be able to be on Medicaid. We're going to have a higher uninsured population. And then what do? How do those people access healthcare and pay for healthcare? And you can be the healthiest person and still have emergent needs and chronic conditions. And so it really puts us in a tight spot.
But we need that money, the limited budget, for war and ICE, as they just passed $70 billion for ICE. You know intimately as a Minnesotan, a Minneapolisite, what that means. And so there's a limited budget, and so there's only just so much you can do. So, a budget is a kind of a moral document. It's a reflection of what your beliefs are. And I just always like to tell people who fall down on that side of things, I say, if you're more worried about like being injured or killed by an immigrant or a terrorist attack than a heart attack, you have been duped. What do you say to that?
Yeah, absolutely. And we always find money for war, right? And we always find money to make the reflecting pool on
well, that was needed. I stand for that.
Statues and arcs and whatever.
I'm for the reflecting pool. Last time I was there, I was like, it needs a liner, I think.
So lots of other projects. We always find money for that. Why can't we find money for the thing that makes sure we stay alive, right? Yeah,
or just we always get to death, but obviously just like better health outcomes in this case, just better way of life is a huge improvement. So talk to me about, a lot of people say, now you work with folks that are disadvantaged, underserved, I think is the best word. And don't you think those people should have to work harder and have more skin in the game, as they say, before they get treatment? Or do you think healthcare should be a right for everybody regardless of how hard they work? I've made the argument, by the way, let me just answer this for you, and you can make us. Even if you're a piece of shit person, even if you have no job, even if you've been living off the government forever, even if you treat people poorly, even if you hurt people, I still think you should have access to health insurance and healthcare. I still do.
Yeah. It's a human right. Healthcare is a human right. As former Minnesotan Senator Paul Wellstone would say, we all do better when we all do better. Yep. So if we all can be healthier and help each other in our communities, contribute to society in better ways, we are all going to do better. And when you help someone else out with their healthcare, eventually the money comes back and helps you with yours. We all benefit from this system. And there is no reason that we should say, oh, pull yourself up by your bootstraps and get yourself through your heart attack, right?
Well, what about babies?
Yeah.
They should. Do you think we should put them to work?
Yeah, put those babies to work.
In the mines.
But it's also, the situation where they don't want people taking birth control. They don't want people to have access to abortion. Right. So you're forcing pregnancies in some circumstances. And then once that baby is born, you're not going to provide any support or social services to have good outcomes, to have a good childhood, to have a healthy upbringing. So what do you want?
Well, it's such a, that's Paul Wellstone, the noted progressive leader from Minnesota, but you could make a conservative capitalist argument for this. If you want to save money, then I used to argue with an old CEO of a company I used to work at, SiriusXM, about why wouldn't you want government health care so that you as a company didn't have to provide it? And he argued, well, it gives us leverage over other companies and so on. And I was like, well, you're the only game in town. There's only one satellite radio. But regardless, the point being, if you're a capitalist conservative and you care about, quote, fiscal conservatism, I would argue you don't. Because of this, if you cared about, you would invest in people's health care now so you didn't have to pay for it. And the other end of it, it is a no-brainer. Same thing with early childhood education and education in general, right? It is a fiscally conservative concept.
Yeah. And when it comes to reproductive health care, there's been a statistic forever. For every dollar the government spends on family planning, they save $3 overall. So it is cost saving. There's a chapter in Freakonomics about abortion as a capitalistic economic good. So
that's not God's will, though.
Yeah.
The savings on abortion. I mean, it really is overwhelmingly a religious argument in America and anywhere else. When it comes to reproductive rights, let's just be honest. It's overwhelmingly religious. Religion is overwhelmingly led by men. How do you explain where this resistance to not healthcare specifically, but specifically women's reproductive rights or women's healthcare in general? It's always been this way, even in more liberal countries to a certain extent, right? I mean, this is about kind of patriarchy and religion, isn't it? Do you think there's some nuance there that needs to be?
No, it's all about control over women, and women shouldn't have sex because they want to. They should have sex when a man wants to have sex with them and when it's time to make a baby. And that's kind of what it boils down to when you look at opposition to birth control and abortion and everything else.
Let's talk about what I specifically booked you to talk about, which is a headline, of course, development. You follow this very closely, as do your colleagues, the great folks at Committee to Protect Healthcare, which everybody should be following and supporting. Here's the headline, or here's the article at the Wall Street Journal. The Food and Drug Administration, I want to edit it. The former Food and Drug Administration, the Food and Drug Administration has launched a safety study of the abortion pill, also known as mifepristone, a step that could pave the way for the Trump administration to restrict how it is distributed and used. The study marks a victory for anti-abortion groups, Republicans, members of Congress, who have demanded action from the administration to crack down on the pill's use. In recent months, anti-abortion allies had lost patience with assurances from administration officials that a study would be conducted. Okay, so let's just say, I've heard the abortion pill is safer than Advil.
Yeah. So to me, launching this expedited review is like if the government said they were going to do an expedited review to determine the shape of the Earth. We know that information. And then they say, if NASA calls, sorry, we're going to be at the Flat Earth Society convention. We know what their conclusion is going to be, and that it's not going to be based on the opinion of experts, the best data that we have. And we've had the safety of mifepristone established for decades. This drug initially came out in France in the 1980s. After more review in 2000, introduced here in the United States, it's been used for decades. It's very safe. When it comes to medication abortion and management of early miscarriage, it makes it safer than just using the other medication alone. It prevents needing procedures. It prevents increased risk of hemorrhage and infection from some of the tissue not coming out. It is a very safe medication. It is life-saving. And so questioning it in this guise of protecting pregnant people, they would never say pregnant people, they would say women, but protecting women is bogus. It's insane.
Okay, it's bogus and it's insane, but let's get a little bit more granular here because my optimism lies in, when it comes to the issue of abortion, in this pill, its safety and its continued accessibility. The question seems to only be about accessibility. Mm-hmm. So where women can't get it, then they're in bigger trouble. Then they might have to get a surgical procedure. And then that means they might have to leave their state. And there's all kinds of other issues. But my optimism lies in, and I almost don't want to say this out loud, but you'll just tell me what you think about it, that there's no way you can prevent the vast majority of abortions, because the vast majority of abortions now are taking place through this pill or something similar. And so you can't stop a pill. You can't stop cocaine from getting in the country from South America in large ships. You're not going to stop these safe, important miracle pills from getting to women who need them. Tell me what I'm missing here about how they are trying to stop them and how they might be able to stop them, where they're stopping accessibility.
Yeah, I think creating fear is the way that they're stopping it most. You know, they have these bounty hunter laws in places like Texas, where if you are found to have access to abortion pills, or you're someone who helped someone get an abortion pill, or you're the doctor, or you carried a package with the abortion pill to someone, anyone can say, hey, this person broke the law, and you can go to prison for that. So just making this fear around the medication existing and potentially being in your possession, having this in the headlines, people are worried about that. And not everybody knows, you know, what states does this impact? Where is this going on? How does this affect me? And it scares people away from getting the healthcare they need.
I'm inspired by previous generations of civil and human rights leaders with everything that we talk about. When I think about how hard things are, how I want to affect change, and when I want to give up, I think about them. And when it comes to women's reproductive rights, there was a generation of women, I think it was in the 70s, mostly women, who basically created an underground railroad that helped other women through a series of like special phones and quiet whispers and messages passed to get women to a doctor who will take a huge risk and perform this procedure. And I think if those women and doctors and people could do it, our generation can do something arguably easier, which is to make sure any woman who wants it can get these pills.
Yeah, absolutely. And there's lots of organizations that are hoping to make that happen. I thought about the same kind of thing when we had the ICE surge going on here. You know, it was really hard to try to organize people kind of in secret underground to try to help people who needed care and were scared of ICE. And I was like, okay, generations ago, they did this and they didn't have cell phones and they didn't have social media. They didn't have ways to communicate like that. Like, we will figure it out in some way. But it is a lot harder because everything is constantly tracked now. Like, we live in a surveillance state, and it's very easy to find the electronic paper trail for a lot of things. So I think we can do it, but it's in some ways easier, in some ways harder.
Take me inside. Just say a little bit more about where you see this going politically. I'm not sure how much you studied the politics of it in terms of the numbers, in terms of legislation, in terms of the courts, and obviously the highest court, which is run by commanders from Gilead. But where do you think we're going here on mifepristone in the near future?
Yeah, I think for at least this review, they are just going to ultimately try to remove the telehealth access, the remote access to it, that I can send it to someone's pharmacy or send it by mail, and I don't have to physically hand it to a patient, which used to be the law. You had to physically give the prescription to the patient, give them the pills, and oftentimes they'd have to take them right in front of the healthcare provider. During COVID, it changed so we could improve access to care with less.
Is that true with, is that true with other medications that you have to physically?
Ew. So the only thing that
people give themselves their own injections. My dad gives himself shots.
Yeah. But the only other oral medication that is a regulation for is methadone, treatment for opioid use disorder. And the reason you need to go get that in person is because there's such concern about misdosing and abuse and things like that. But even not everyone on methadone has to do it that way if they've been on it a certain amount of time. So they're making the mifepristone unique in a really dangerous way. There's no precedent for this at all. And it's completely unnecessary. There is no evidence that it is any different to have it mailed versus get it in person in its overall safety.
So forgive me for not understanding what that consequences mean, but if you remove telehealth access, it means a woman in a state where they don't have access, because it's different in red states and blue states. Is that too simple to say?
Absolutely.
It means that she can't call a doctor and you in Minnesota and have you send that. And what does that mean? What are the consequences?
Yeah. So having telehealth availability, that is one of the huge things that it helped. These states that have restrictions, people in red states who would otherwise have to take time off, travel, spend money on just getting to the healthcare to access mifepristone, we're able to get it through online sources, telehealth services. But even in the state of Minnesota, I mean, there's people in rural areas of Minnesota, in healthcare deserts, who this has benefited tremendously as well. And if you remove that, now there's lots of people who, again, they need to take extra time off, which they may not be able to take. They might have to access transportation in ways that they don't have good access to. They then have to spend money just to get to the healthcare appointment to obtain that medication. And it makes it just so much more obstructive. They're doing anything they can to try to circumvent any laws that do exist, to say, well, no one should be able to access this.
All right. I think this is the last subject or a couple of questions I want to ask you about fraud. And I think I specifically want to talk about it for undocumented people when it comes to healthcare. This is one of the most controversial and effective kinds of lines of attack and demonizations of people in the system, and lies and I think exaggerations. But just in general, what do you see, what do you know about fraud in terms of patients abusing the system, whether it be Medicaid or Medicare or SNAP, any federal government program, much less a state program? How would you commit fraud as a patient trying to get health care? Much of the fraud takes place in other clinics and nursery, schools trying to get money from the government that they don't deserve or qualify for and so on. But my assertion and my understanding is that it's very uncommon. It's very hard to do, especially with the federal government. What's a state government? They're pretty stingy in what they hand out. But you see these big numbers, and it looks like it's but the only thing that matters is the percentage, in my mind, the percentage of fraud in any one of these programs. My understanding is in like the single digits, depending on the program, depending on what we're talking about. So just talk about fraud in general, what your thoughts are, and then we can kind of specifically tailor it to an undocumented woman comes to you for care. How does that kind of work, and where, if any, lies or fraud comes in? Because I'm pretty sure you don't ask about their citizenship.
Yeah, I mean, fraud is exceedingly rare on the patient's part of it. They just need access to healthcare, and they'll get it as they can, and not often pay out of pocket. If
they're not stealing anything. You don't steal healthcare. Like, I don't want to go to the doctor. I don't want a colonoscopy. I don't want it.
Yeah. And, unfortunately, the Republican Party tends to be, we want to prevent fraud to such a degree. We'll make sure people that actually do qualify for this don't get it, rather than making sure even one person could commit fraud in any way, right? They'd rather not help people who they feel like don't deserve it.
And they lie about it. They lie or exaggerate ridiculously about how fraud takes place. The easiest place to look is voter fraud. It's just not happening because it wouldn't be a crime anybody would commit. Why would you do that? For what reason? What do you get out of that? It's not happening. And you could say the same for patients in terms of fraud in healthcare. So if an undocumented person comes to see you, how does that work? You can make an assumption that they're undocumented, but you don't know necessarily how do they get care from you, preventative care. How do they qualify for it? I mean, Republicans, they put in a stipulation with Obamacare that undocumented people couldn't buy health insurance, which was the dumbest conservative idea, because you want undocumented people to have health insurance so that you don't have to pay for their care in the ER. You want them to have auto insurance so that you get paid if they hit you. You want undocumented people to have health insurance, right?
Yeah. Exactly. So if a patient presented to an outpatient clinic setting and we're hoping to access care, there's a lot of clinics that will provide free care in those settings. Those patients may be paying out of pocket as well. That's often the case that ends up being. Otherwise, social workers are working with them to find out other ways to afford that. I'm only in the hospital setting, so I'm on the emergent care basis. So when a patient presents to care to me, I don't care where they're coming from. I don't even care what kind of insurance they have. I'm going to provide the care that they need in that moment. And hospital social workers and other people on the staff can help us figure out how that cost is going to be covered. And in some situations, that does mean the hospital eats the cost. And that's unfortunately for any uninsured person as well, immigrant or, natural born U.S. citizen. So that is how our healthcare system is set up. We will provide care to the people who need it. And sometimes that money comes from the government and sometimes it does not.
You want it to. Everybody wants it to. All right. This is the last one, I promise you. And this is it might be annoying because you might get it every day. It's about the pit.
Oh, no.
Okay. So first of all, there's this one scene where a woman comes in and nobody in the hospital knows what language she's speaking. And it takes a long time in this episode to figure out where she's from. And then one smart person comes in with a map. I'm like, how come they didn't come up with that earlier? Or Google Translate, like just speak into my phone.
Right.
Have you ever had a situation where no one knew where this person was from and that's never happened, I'm guessing.
I don't think I've ever had a situation where we didn't know where they were from. I've had situations where it's such a rare language that you cannot track down an interpreter, which is really difficult then to try to figure things out. You mime as much as you can, play a little
Just
dictionary.
Get a map. Yeah, that's where we'll find somebody. Okay, the other more serious, important question is there's also a scene in the pit where a young woman comes in to get an abortion in the ER. She's there with her aunt. Her mom then comes in and says, oh, hell no. And because she's a minor, the mom, at least in that state maybe, and it's set in Pittsburgh, gets the decision. And is that a common thing that a woman comes in without her parents' permission to get an abortion and then the parent shows up either then or later and is very upset with you?
I think that would be state dependent. I personally never encountered that, but every state is so different with their laws. For some minors, they need one parent permission. For some, two, which can be difficult if you have not had contact with a parent.
Really? Two parents' permission? I never heard that.
Yeah. And in some states, it is the minor's choice because once they are pregnant, they are considered kind of their own person who can make their own decisions in some ways. So it is very state dependent. And then coming to the emergency room to obtain abortion care would be very rare. Most emergency settings, they are not going to perform that. It would be great, though. I think it would be awesome if emergency physicians were better trained at abortion care and all primary care physicians so people can get it at whatever contact point in the healthcare system, they can get that healthcare. That would be wonderful. That's not going to happen anytime soon, but that's in the future.
You're doing such important work. You have your whole career. What would you say to a young person who wants to be Dr. Erin Stevens when they grow up?
Go for it. And there's so much change that we can make when we have the expertise, even though there is that anti-science, anti-medicine movement right now. We are still respected and valued by some people, and having the knowledge to change people's lives for the better is incredibly impactful.
I'm sure it's really satisfying when you get good outcomes, and more importantly for your patients, for the women whose often lives you've saved, has certainly made them a whole lot better by giving them the choice to control their bodies. How about that idea? Really appreciate. Oh, you know what? Just say something about Minneapolis and your experience. What do you want to say? I have a lot of listeners from there, and I interviewed a few people who were very involved. What a triumph you people achieved. What an I did not think that would happen. I don't know Minneapolis well enough, but I know America, and I'm a little cynical. And the way that people showed up for each other in our generation, people over 30 and under 60 or something like that, really showed up for each other. What do you want to say about that experience and the way that you protected the least amongst us?
Yeah, I thought it was such a moving experience. Everything that you saw in the news was happening, 100-fold over of communities, neighborhoods really helping each other. There were parents that would go to the schools and be neighborhood watch, 24/7 to make sure no kids would be obtained by ICE or any families would be obtained by ICE. There were people having food drives and donation drives for other goods. There were people helping get prescriptions to people who were sheltering in place, healthcare workers figuring out how to provide care in the home. It was just such a community effort. And if we could do that at all times, really show up for one another and be there for each other, this country would be a much better place.
Even if we didn't do it for all time, if we did it a lot of the time, like what you guys did, it was life-changing for yourselves to see that you could have an effect. People are so cynical, and we don't blame them, especially here in America, about can we help folks out? Can we come together? Can we create solidarity in a community of any kind and help people? And we see that we can all the time. We just don't remark upon it. And what Minnesotans did was such an inspiration for the rest of America to know that we can win. We can push them back, and we can protect people, and we can win. And I think that was just the greatest thing that's happened in this nightmare that we're living through. I got to say, that was a huge human accomplishment.
And it was in such a joyful way, too. I mean, any of the protests, there were people playing instruments and singing resistance and all sort of, we're together and we're here to help each other, and we can have joy and love despite all the hate that's out there.
Keep up the great work. Thank you so much for joining me. Let's do it again whenever you want. Yeah. I learned so much, and I really appreciate all the work you're doing. Go follow her on Instagram, Dr. Erin Stevens. Thanks, everybody, for watching live. I'll talk to you tonight. If you're a subscriber at our Hangout, we'll invite Erin to join us one night and take your questions. And I'll talk to you later. Bye-bye.
Bye.
All right. There she goes. Bye, Erin. That was great. Very smart, very cool woman, and a great, great person out there in Minneapolis for a lot of reasons. Love that conversation. She hung right up, by the way. There was no talking after. That happens sometimes, and I always feel bad. I'm like, did they not have fun? Did I take them too long? But I think she thought I was saying goodbye to her, or maybe she was in a hurry. I don't know. Either way, I hope she comes back and joins me, because that was a great conversation. I learned a lot. Thanks for everybody who joined me live as well. And I hope to see you tonight at our Hangout. Thank you for your support. Thank you for your subscription. I can't do it without you. And that is all I have got today. I will talk to you later, and hopefully tomorrow. John Carroll taking us out as always.
When the tyrants taunt you and the sirens tease, you better stand up. Stand up. Let the brave meet the challenge. Let the weak flee. Oh, you better stand up. Stand up. When you're tired of begging, saying pretty please, that's the time you gotta finally get up off of your knees. When you can't see the forest for the burning trees, you got to stand up. Hey, you've been sitting so long, you got the creaky knees, you got to stand up. Stand up. I think you're driving wheels with leaking grease. Boy, you better stand up. Stand up. Well, there's a whole lot more of us who know what's right. They'll keep right on ignoring us if we keep sitting tight. You got to open up the window to let in some light. You got to stand up. That's right. You got to rise up. You got to stand up. You got to stare the devil straight in the eye. We got to let him know it's his turn to go. See it clear when all you hear is a lie. So get up off of your butt, down off of your fence. And even if it ain't a very friendly audience, well, they'll begin to listen when you start making sense. And you stand up. Stand up. No need to point your rifle to defend your town. Just stand up. Stand up. You know they can't deny you what you're laying down. Oh, you better stand up. Stand up. Show your face of every color, yellow, black, red, and brown. This is the place where every lost child will finally be found. There's only one thing to do before we stand our ground, and that's stand up. Stand up. Well, the founding fathers saw a land for all. They had to stand up. They had to stand up. They had a keen imagination for a crystal ball, drawing all the plans of a stand up. But all they had to go on was the time they were in, with other causes for laws, and since they weren't even sin, they knew that change was gonna come before the change could begin. They had to stand up. All right, they had to stand up. We got to stand up. We got to look the devil square in the eye. We got to let him know it's his time to go, and make it clear when all we hear is a lie. Why you lying awake wondering where the money all went? It'll be the cost of freedom that'll go unspent. You can see him flee the scene of that experiment if you stand up. All right. We got to speak up, we got to reach up, and raise your voice in every way you know how. Don't be told to suck, you got to show up. Ain't no better time to do it but now. No need to pledge allegiance to no wanton tribe. Rise up, show obedience to the voice inside, and listen well and it'll tell you not to run and hide. It says stand up, stand up.